Hi, this is Dr. Adam Stewart, and I'm here to give another behind the scenes look at some of the struggles that we family doctors are dealing with these days. This is about the struggles we go through trying to connect patients with a high need specialty like neurology or a specialty that has a long wait time. And I'll preface this by saying this isn't meant to criticize our neurology colleagues in any way. I know that they are trying to probably deal with their own supply and demand constraints as well. Although I will point out a couple of criticisms later on throughout the video. But the main purpose of this is to show the perspective and the struggles from family doctors and our staff and our offices when we need to make referrals like this. I happen to practice in Madoc, Ontario, which is near Belleville, and we refer to Kingston Neurology if we need a neurologist. I'm not sure what it's like in other areas of the province, but like referring. So if a family doctor has a patient who has an issue, we should be able to just fax off a referral, and mark it as urgent or elective, or a certain time frame. It needs to be seen in 1 week or 3 weeks, or can wait a year if need be, or 6 months. We should be able to fax off referrals, and I've already shown in another video how even though sending a simple fax like that actually takes 5 to 10 minutes of staff time and resources. There's this video here on if you go to my website, stewartmedicine.com, the blog section has this invisible work, paperwork after a visit. But so that's the standard way. So you would think that if a family doctor has a patient with a new seizure or a new diagnosis of multiple sclerosis or a new worrisome tremor that you're worried about Parkinson's or something like worrisome like ALS or something, we should simply be able to fax off a referral to our local neurology department, mark it as urgent, and have that referral triaged and the patient be seen in a timely fashion. But that is not what we experience, not at least with Kingston Neurology. Whenever we fax a referral, we get a reply back to Kingston. If we would do it the standard way to Kingston Neurology, we get a standard reply saying that our fax has been received and that there is usually a 1 to 2 year wait time. And it says, if something is more urgent, then we have to call the neurologist on call. So I'm going to show you. I made a few notes here on. I'll show. This is the process by which we have to refer to neurology. Okay, so the family doctor recognizes that the patient needs to see neurology urgently. Family doctor faxes an urgent referral to Kingston Neurology. Around 1 week later, we receive the confirmation that the referral has been received and that the wait times are probably going to be 1 to 2 years. And there's this standard always line that says, if you require a more urgent consultation, please contact the neurologist on call. So what that means is now in the midst of a busy day where family doctors are trying to run room to room to room and deal with messages and patients already, we have to actually then pick up the phone, call Kingston switchboard, which takes several minutes to get through on, and then we have to ask to speak to the neurologist on call. What then happens is after several minutes of finally getting connected, we don't actually get to speak to the neurologist. We always get the resident, which is no offense, but it is the trainee doctor, and who the family doctor gets to speak with. And the family doctor then has to give the name and the health card number and all these details to the resident and explain some of the details and concerns and plead the case for why this patient needs to be seen urgently. The resident takes down this information, and then the family doctor, we leave our cell phone or a number at which we can be called back later. And by the way, this isn't just one story. This story repeats itself. This is a pattern time and time again of the experience of every single time I've needed to get a patient to see neurology over the last few years. So maybe a few hours later that day, the resident calls me back and as the family doctor, and the resident has reviewed the case with the neurologist, but unfortunately there are no spots that the patient can be seen urgently by the neurologist. Again, we're told the wait times are pretty much 1 to 2 years. And instead, the resident suggests that they can maybe see the patient in what's called the urgent care residence clinic. So I take it to be a urgent care neurology clinic that's run by the residents, not the actual neurologists. So okay, we're told the patient will get in to see them in a few weeks. And of note, the family doctor, as a colleague, never actually gets to speak directly to the specialist colleague, the neurologist. And that is one of my criticisms I will point out. If a neurologist calls me as a family doctor about a patient, you can be sure that I'm going to pick up the phone and take the call. I'm not going to direct the neurologist to speak to my nurse, for example, and she'll take a message for me, right, and relay it later. Just a little bit of collegiality there would probably go a long way. Anyway, the family doctor then faxes the referral to the urgent care residence clinics as they were instructed. And by the way, that's yet another referral, a different set of paperwork, as I mentioned in that other video, that takes another 6 to 10 minutes. The majority of the time, it takes a few weeks. A few weeks will go by, and the family doctor hasn't heard anything. I've sent myself a message to hear back from this, so I have to get my staff or I to dig into the status of the referral. Except for there's no one actually at Kingston to contact. There's no reception for this department. There's no one to speak to. So I, again, as the family doctor, must pick up the phone in the midst of my busy day and call the neurologist on call. And I have to repeat the steps above that I already just mentioned, go through that whole chain reaction, because it's a new doctor and a new resident on that day, as always. So then this time the resident, they have no record of the prior discussions because it's different people. So I have to repeat this whole thing, send yet another referral, but I'm careful this time to make sure that, to get a specific appointment time for the patient. So let's say we're usually told 2 to 3 weeks from then. So then we wait another 2 to 3 weeks, and the patient has surely been seen. We'll actually call the patient, hey, were you seen by the neurologist? They'll confirm, yes, they were. We don't have a note, so we and our staff, family doctor and their staff, then have to go digging. Half the time, we never ever get a note back from these clinics, and then when we do, it's usually like a handwritten clinic note that's illegible in short forms that have really no clear answers, diagnosis, nor plans. And what we end up having to do as family doctors is rely verbally on what the patient recalls from the visit and what they were told. So this is a little story of what we have to deal with. And in another video, I'm going to give you a very an actual case example of this that I went through recently that I have permission to share.